Well, good morning everyone. Nice to join you here today. A lot of interest in today's announcements, and there will be some significant things to talk about today. My name's Dougal Saunders. I'm the state member for the Dubbo electorate. I'm joined today by Scott McLaughlin once again, who's the CEO for the Western New South Wales Local Health District. Joining us also today, Deputy Commissioner Mick Willing. Mick is the New South Wales Police Regional Field Operations Director, also a former Dubbo boy, so it's good to have Mick back today. And we're joined by Colonel Warwick Young. He's here from the Australian Defence Force, and he's the Commander of Operation COVID-19 Assist, and once again joined by the Mayor of Dubbo Regional Council, Steve Lawrence, as well. Council collaborating on this has been absolutely crucial, and we very much appreciate all of that collaboration. There's a few things to talk about today. I'll start off with positive cases. Up until 8 o'clock last night, there are 25 new cases for the health district. Now, there is some clarification required on numbers that were released earlier on this morning. So 21 of those 25 cases, I should say, 21 of those are in Dubbo. 4 are in Mudgee. There were 2 that were mentioned at Brewarrina. Those 2 are actually in Mudgee, so that takes Mudgee from 2 to 4. And 1 was mentioned in Bathurst. That case is also now in Dubbo. So just to clarify again, 25 cases for the health district, 21 in Dubbo, and 4 at Mudgee. That now means that the total active number in the health district is at 167. There are 4 patients in hospital, and Scott can talk a bit more about that and their healthcare needs when he addresses things. There are also 2 overnight cases which aren't included in these numbers. That is 1 for Gilgandra and 1 for Burke. They will be included in tomorrow's numbers. Now, joining us here today, obviously the Australian Defence Force and Police again. I want to thank particularly the ADF for being here and present today. They'll talk about some of the solutions that they are working on, the collaboration that is happening with not just police but also community as they are in Dubbo and then heading further north and west, right across the region to deliver vaccinations. And there'll be significant numbers of people we are hoping come forward for vaccines, not just in Dubbo and Wellington, but across the entire western region over the next 4 weeks or so. Saturday, we'll have more details of exactly the timings and how it will work, but Saturday we'll see our first walk-in clinic established at the Pioneer Park near the hockey facilities in Dubbo, Saturday morning from 9 o'clock, and more details from Scott on exactly what that will mean, and there'll be more details provided with exact scheduling and the sort of things you need to do throughout the day. Essentially, it will be a clinic for anyone who can get there with a Medicare card. Simple as that. Anyone is welcome, everyone is welcome. That starts at Saturday morning, 9 o'clock. I talked yesterday about the possibility of a hotspot declaration for Dubbo local government area in particular. I just want to clarify today, I have had discussions with the Deputy Premier on several occasions now about that and whether in fact that is the best thing to do at this particular point in time. I've spoken to several businesses, I've been in contact with the Dubbo Chamber of Commerce. We will investigate the best way forward from here. It may not be declaring Dubbo as a hotspot, because with that declaration comes a lot of other different restrictions that we don't currently have, which could cause more problems for businesses that are currently under stress. So be assured that is something that is being talked through. It is not a definite that we will want to be a hotspot, but it is something that certainly is being looked at. In the near future, they will remain open to do all the testing we need. Reports back today, particularly for Dubbo, are that most of our testing facilities are a bit quieter. We do encourage people, if you are concerned in any way about where you've been, go and get a test. If you've got any symptoms, please go and get a test. Obviously, one of the things we've also been very well aware of is the results and the time it can take to get those results back. I've personally responded to hundreds of emails and questions and messages. There is no magic button. The people behind me are all doing everything they can to make sure that this is absolutely as streamlined as possible. We've had pathology people affected locally. We've had pathology people affected all across the state. If somebody in a pathology clinic is forced to isolate, that clearly makes it more difficult for those results to be turned around in a timely fashion. So this is affecting all of us in slightly different ways. Sometimes that impact can be on when we get our test results back. But please know that we are doing absolutely everything we can to make sure that all of that happens in the quickest possible way for you and your family. We do care, we know it's important. On that, there are also some specific numbers to call. We have posted them on this Facebook post right now. So if you're watching this, go back to the top and check all of those numbers. There is the local health district number. We've mentioned that many times. That's 1300 066 055. That is specifically for health district swabbing and any other health requests. If you've been tested by Lavity, Lavity has its own separate number, and that number is freely available. You should get that number when you go for your test. That's a simple one of 13 39 36, and histopath is 9878 8173. Again, all of those details will be on this post so you can check in. Contact tracing we've talked about before. We do want you to leave it to the experts. Don't necessarily post that you think you've had somebody in your business or are a close contact until you have been notified by health and health has made that official announcement. It just keeps everyone in the same position on things. And venues of concern obviously will continue to grow. That is the nature of things. We are posting them as quickly as possible. The health website is a fantastic place to get all that information, and all of us collaboratively are sharing that on social media as soon as we have it. Sewage testing continues. More sewage testing available in some of our smaller areas. That will be happening over coming weeks. Police activities, Mick can talk a bit more about this, but thanks to Danny and his team locally, there is a bit more focus on some of the areas that have turned up to be slightly more difficult. Some of those involve supermarkets. If you're going shopping, it's supposed to be one person per household. You need to wear a mask, you need to sign in. Simple as that. Police will be helping enforce that because staff are finding it particularly difficult, and we want to make sure that they're able to do their job. As far as schools, I just want to finish with a quick update from schools. We do have some schools that are back as operational from today. We do want you to keep your children at home if that is at all possible. If you can learn from home, that's what we want you to keep doing. And the majority, around 98% still, are doing exactly that. We want that to continue. But a number of the schools that have been non-operational are now operational again after deep cleans. That is only if they are required, but they are open if you need them. So Dubbo South Public School back open, Dubbo Delroy Campus, Buninyong Public School, Meehan School and Mudgee High School, all operational again from today. If you need their help, they are there for you. But I just wanted to also quickly share, and again we'll put these figures up for you, school communities are part of our overall community and have been impacted massively. As an example, Dubbo South Public School, 6 student close contacts, 5 staff. Delroy Campus, 125 student contacts and 5 staff. Buninyong, 203 student close contacts, 44 staff. Meehan School, 3 students, 11 staff. Mudgee High, 138 students, 13 staff. The non-operational schools that are still not operational right now include Dubbo West Public School. That school has had 452 student close contacts and 74 staff. Arana Heights Public School, 672 student close contacts and 88 staff. And Dubbo College South Campus has been the most impacted, 716 student close contacts and 113 staff. They're part of our community. We are all part of the same community, and our thoughts are going out to those people. The final message from me today is that we can all do something together. We can all be supportive of somebody, help somebody, reach out to somebody, whether it's on the phone or maybe a video call. Do what you can to be supportive. Keep helping spread the message of vaccinations and testing, and show some love. I'll now call on Scott McLaughlin. Thank you.
Thanks, Dougal. Another sobering day and concerning situation in Western New South Wales. We have 25 new cases to 8 p.m. yesterday. That brings us to a total of 167 cases. Out of those 25, 21 are located in Dubbo and 4 located in Mudgee. Now, as Dougal flagged, there's 2 cases that have been highlighted in Brewarrina. Both of those are actually in Mudgee, and 1 case that's been highlighted in Bathurst, that's actually in Dubbo now, so be really clear about the numbers. Overnight we've seen 2 new locations identified with cases of both Gilgandra and Burke. The majority of our community, majority of the confirmed cases overnight were infectious in the community. We are seeing a decreasing number of those, and that's pleasing, but there are also community cases being infected in the community. The age groups, again, the vast majority are between 10 and 30 years old. We've now got 8 patients in hospital in Dubbo. 4 of those are children who are staying with their parents in hospital. They're not requiring hospital-based care. Out of those 4 patients in hospital, 1 of those is in intensive care at the moment. We've now got over 177 people in our care in the community team, all requiring specialist care at home through our specialist clinicians. And in the last 24 hours, we saw a decrease in the number of tests being done across the region. We saw about 8,000 tests being done. That's a decrease from around 10,000 over the last 3 and 4 days. And so I really would say to every community across the whole of the region, please come forward and get tested. If you've got any symptoms, however mild, any concerns, please come forward and get tested. This is a really crucial time for us. We've now got over 89 venues of concern listed on the New South Wales Health website. Can I please urge everyone to go and look at that on a regular basis? There were quite a few updates overnight. Overnight we've had 20 new locations in Dubbo, 2 in Burke, 1 in Bathurst and 1 in Gilgandra. And so please everyone have a look at that. Make sure if you were at those locations at those times, get tested and isolated until you've got the results. The sewage testing, we've taken quite a few sewage tests yesterday. We expect those results back overnight tonight. The results that came back previous days from Orange, Bathurst and Clark's, going to please urge everyone in those communities and cities, come forward and get tested. We want to find where COVID might be circulating around those communities. In terms of testing numbers, yesterday Dubbo saw 3,900, Mudgee 1,455, Bathurst 462, Orange 481, Parkes and Forbes about 100 each, Wellington 145, and pleasingly Burke 213. Can I please encourage everyone again, come and get tested if you've got any signs and symptoms, however mild. The testing locations, as Dougal announced, will stay open for the rest of this week. We'll look at those schedule later on in the week and make any changes for next week. The accommodation that we've established in Dubbo is continuing to grow with the number of both confirmed cases and close contacts and household people that are needing accommodation. We'll continue to expand that in coming days. We currently have around 126 staff in isolation or being tested and awaiting results at the moment. Now, that's putting some pressure on our services, but we're still managing all of our services. Our emergency departments and acute services are still open 24/7 right across the region. In terms of vaccination, we've got some very positive news with the Australian Defence Force that arrived in Dubbo and seeing a big throng of the team arriving in the next 24 hours. We're planning to kick off vaccination here in Dubbo and West Dubbo at Pioneer Park on Saturday with a walk-in clinic that people don't need to book for. And so I really would encourage, particularly the community of West Dubbo, but right across the community, come and get a vaccination on the weekend. We've got a program over the next 7 weeks that'll see locations right across the region see vaccination clinics accelerated, either through the Australian Defence Force or through other providers of vaccination that are coming into the region to try and help us out to get to that magic 80% mark over the next couple of months. So it's a pretty exciting time. I really do welcome the Australian Defence Force into town. I know they're here to help, and it is a great opportunity for Dubbo and the region. So thank you. I'll leave it there.
Good afternoon, ladies and gentlemen. Can I firstly thank State Member Dougal Saunders, the Mayor of Dubbo, and of course Scott, and for allowing me to say a few words today. It's also great to be here alongside my friend and colleague, Colonel Warwick Young from the ADF. I'd like to begin by thanking the local police, who are under the leadership of Assistant Commissioner Jeff McKechnie and of course Superintendent Danny Sullivan, working alongside health officials in the ADF, and of course the entire emergency management team supporting the Dubbo community and far-reaching communities through this difficult time. The ADF, of course, have a long-standing history of working closely with the police, and we've already seen the ADF on the ground in the last day or so delivering support packages to people who are having to self-isolate at the moment. Of course, the briefings that I've received certainly this morning about operations here lend to the fact that the team is working so closely together, which is absolutely critical to ensuring that everyone gets through this difficult time. But more importantly, I want to thank the community of Dubbo. and those who are doing the right thing at this difficult time and abiding by the current health orders. As Dougal mentioned, I am born and bred here in Dubbo, as many of you know, and I've seen Dubbo go through challenging times before. And it's the community cohesion that always gets Dubbo through difficult times. And of course, that will underpin undoubtedly the Dubbo community and far-reaching communities getting through this difficult time as well. Of course, compliance to the public health orders is going to be a critical component in getting through this difficult time as well. Operation Stay at Home was launched by the New South Wales Police earlier this week, which has seen thousands of police officers from police districts and police area commands across the state dedicated to ensuring that people abide by the public health orders. Underpinning that operation are of course strengthened public health measures. And of course we don't want to be having to give out infringement notices or arresting people for not abiding by the public health orders, but we will. It is such a critical time. We need people to stay at home. I'll finish by just saying that my plea to people in the Dubbo area is stay at home, do what you can. I'm hearing good reports at the moment of people moving between towns, that the volume of that is diminishing, which is great to see, but I need people to stay at home during this critical time. By working together, as Dubbo always does, when it rolls its sleeves up, it gets through challenging times. Working together with the support of the emergency management community, I have no doubt that the Dubbo community will get through this challenging time. Thank you.
Hello everybody, Dougal, Scott and Sir, thank you for your kind words of welcome. The ADF is very happy to be here. We were invited by the New South Wales Government to assist them in their whole of government approach to the Operation COVID Assist here. And part of that is delivering support to the community of Dubbo and the regional area. And we're doing that through two lines of effort. And the first line of effort is to assist the New South Wales Police in their well-being and their community engagement tasks by providing care packages, etc., and assisting in wayfinding at certain locations. But we're also, and that includes testing centres, but we're also assisting the police in helping the community understand they need to do the right thing. The other line of effort that we have is providing vaccination teams. Those vaccination teams will arrive here in Dubbo tomorrow, and they'll be on the ground assisting the community by providing vaccinations to not only the community of Dubbo but other regional areas and particularly vulnerable remote communities from Saturday. We're very happy to be here. We hope that we can assist the community in recovering from this pandemic, and if you have any questions at the end, of course I will answer them. Thank you. Okay. If you got any questions, fire away.
Can I just clarify, how many ADF people, like personnel, are coming in total, and then where are they being directed? Like how many to the vaccine and how many to the compliance measures?
Okay, so we've got 50 personnel that are going to be assisting the police in the community engagement activities and making sure that people are doing the right thing. And then we've got 5 teams, what we call vaccination outreach teams, which will total about 70 personnel, and they will be delivering those services in the 5 teams to different locations around, starting here in Dubbo and then out to regional areas over the next 8 weeks.
Could you elaborate a little bit more on that in terms of the timeline for the vaccination clinics being set up in Dubbo and when those teams will go out to the remote communities?
Look, to be honest with you, I can't answer the timeline on that because New South Wales Health is the supported agency that we're doing it for. New South Wales Health are actually engaging with us this afternoon, and that schedule will be out. But of course, we aren't the lead. New South Wales Health is. No other questions?
For anyone else? How many of the 167 are from Dubbo?
21.
Today.
So out of the new cases overnight, 21 were from Dubbo out of the total 25, 4 of the new cases in Mudgee.
So, but out of the 167, how many from Dubbo?
I'll have to get back to you on the total number for Dubbo.
Just on local communities that don't have access to the internet and so forth to find out about vaccinations, what's New South Wales Health doing for them?
We'll have a wide-ranging community information and engagement solution that will have information available for the community. That the new vaccination clinics that will be set up on Saturday at Pioneer Park will be a walk-in model. Doesn't require anyone to make a phone call or go to the internet to come to get a vaccination. So I really would encourage everyone across Dubbo, particularly in West Dubbo, to come for a vaccination on Saturday and Sunday. That vaccination team will be extending right through next week at Pioneer Park in Dubbo as well.
Why has it taken 10 days to set that up?
I think we've been pretty quick to get a lot of the additional resources into Dubbo. We've been scaling up this week already our additional vaccination hubs in Dubbo, Orange and Bathurst. They're now 12 hours a day, 7 days a week, and so that's been a significant addition to Dubbo. We know that there's been thousands of new vials of Pfizer and AstraZeneca coming into both the GPs, the pharmacies, Aboriginal medical services and respiratory clinics, and so there's a lot of vaccination options available. With the addition of the Australian Defence Force, I think there'll be a lot of opportunities in coming weeks for every community across Western New South Wales.
On the messaging,
Just in terms of the testing numbers, Scott, just driving around today, the showgrounds and the clinics are pretty dead, especially when you look at the people lining up over the past couple of days. Is that a concern?
Listen, I'd love to see testing numbers higher. We've seen a 2,000 drop today from the previous 3 and 4 days, and so I really would encourage everyone to come out and get tested if you've got any symptoms, however mild, any concerns, and please, if you can, please have a look at the venues of concern. Make sure if you were in any of those venues, come and get tested as quickly as possible.
For people who've had one shot, can they go to these walk-in clinics, or is it for people who've had nothing so far?
So the vaccination clinics in the Pioneer Park will be primarily for people that need their first shot of Pfizer. But if people haven't had their second shot and they want to come along, then yes, we will provide that vaccination. It's a crucial 3-week window though, and so if you've already got a booking for your second dose of Pfizer, please maintain that at your other primary care provider or the vaccination hub.
there are some issues with errors and mixed messaging coming out. For example, the wrong phone number given to people to get their results. We're hearing stories of people getting told they're positive and not having any follow-up from health for 24, 36 hours afterwards. We've got cases being identified in the wrong locations. What is going on there, and what is being done to rectify those problems?
In terms of the pathology phone number, that was incorrectly advised to some of our testing locations. I really would apologise for that. The new number is available through our Facebook page, our website and a range of other mediums, and so that's a number that people get provided to SMS that then allows them to get their results. So please, if you need to check on that number and you haven't received your results, go to our Facebook page or website. In terms of the contact tracing, we're seeing much faster time frames from our contact tracing teams, with a significant increase in cases across both the whole of New South Wales and Western New South Wales. Our teams are working 24/7 to make sure that that's as quick as possible.
Is there any update on the vaccination rate across the local health district, and how is the system coping with it? I know there's been quite a few people having trouble trying to make appointments.
We're seeing significant increases to the numbers of people that are being vaccinated at the moment right across the whole of the region. About 25,000 people every fortnight, and that's increasing by 30% every week. And so it's pleasing to see those rates increasing, with the Australian Defence Force and all of our additional vaccination teams coming across Western New South Wales in coming weeks. I expect to see that double in the next 2 months, and so I think there's a perfect opportunity for everyone in Western New South Wales to get a vaccination if you're eligible. I really would encourage it.
Given that the majority of cases are in young people, especially that 10 to 19 demographic, what's being done to ensure that they're getting vaccinated?
Vaccinations are now available for people over the age of 12 who are Aboriginal, who have significant chronic and ongoing health issues. We'll be opening up the Pfizer vaccinations for people over the age of 16 across the whole of the region. So I really would encourage young people and old. It's time to get vaccinated, and time is now. our contact tracing teams provided with the home locations of people that they've registered as their home location. Quite often people are in another community where they've been visiting or away from home, and those home locations get triggered onto the website. Now we're trying to clarify that and make sure that everyone is aware that, particularly in communities like Brewarrina and Bathurst today, there are no active cases in those communities. They're in other locations.
So how are they being announced at the 11 a.m. presser incorrectly, and then less than an hour later you're able to say, actually no, scratch that, completely wrong? Like it's sending a message, wouldn't you say?
We'll continue to improve it. There's no doubt we've got things to improve. Our contact tracing teams and everyone is working feverishly around the clock to make sure that we can get to people that have been identified as confirmed cases with COVID or close contacts, and we'll continue to do that.
Scott, is everyone at the Dubbo pathology unit back on deck now, those staff who were infected or identified as the close contacts? And given that the testing numbers do appear to be down today, do you think that will give them a chance to get through some of that backlog?
We have seen quite a few of the staff return to the pathology lab, and so it is back up and running. We do expect some faster turnaround times. Yesterday we saw a lot of the tests taken to both Orange and down to Westmead with record turnaround times, and so I really do appreciate everyone's patience. If you haven't received your results back after 3 days, then please call that 1300 066 055 number.
Question for Dougal, if I could. Just in regards to the impact that it's had on local schools, what's happening with HSC students here? Will they still be learning from home? I think some of them moved to trials.
Obviously HSC students are a particular focus. We know they've been impacted anyway up until this point, so we do want to try and minimise any more impact that things are having on their lives. For trials, most of them will be assessed by local teachers. In cases where they're doing practical type exams, that's being done locally. None of the NESA assessors will be coming to regional areas like Dubbo at the moment, so it will all be done with local assessment based on where that student is up to at the time. It will be checked by NESA, who's the head body for this, but everything is being done to try and make sure that the support is there. The HSC itself, I've spoken to the Education Minister Sarah Mitchell about this. There is a lot of planning around what that can or might look like, and some of it may involve students being able to come together in regional areas that may be from other schools, including boarding schools at Sydney that are currently at home. A lot of that work's being done right now to see the best way forward for them, for teachers involved, and also for, I guess, the entire community.
And just another one on the regional permits, which I believe come into effect this weekend. How will that take place? How can you apply for them? How can you get them? How will that work?
Yeah, look, regional permits are a really important part of the process now of saying you are not allowed to come to a regional area unless you are permitted to do so. In very simple terms, it's Service New South Wales. So there's the website or the 137788 number for Service New South Wales. You apply for a permit. One person from a family can come to an area, for example, Dubbo or Mudgee, if they need to maintain a property. That might include feeding sheep or something like that. That is permissible. It is permissible for one person of the family to do it and go directly back to where they've come from. If they do not have a permit, the on-the-spot fine is $3,000. Police will be absolutely adhering to those rules and maintaining and doing compliance checks on all of that. If people do not have a permit, they will be fined on the spot, and then if they continue to breach, they'll be continually fined and probably escalated.
Dougal, sorry, is there any work ongoing? I know that we've fielded some calls from members in the community who don't have internet access or social media. Is there any sort of work to try and help them out in terms of that growing list of exposure venues and changes to rules and things like that?
Look, I guess there is some reality around the growing list of venues that are contacts of concern. Part of the role, I guess, as community members, no matter which part of the community you live in, is about making sure that people around you, your friends, your family, your colleagues, are aware of the same venues that you are. So I guess we're asking for the community to do the right thing and help share things. If you know that you've got a friend who has no way of knowing that venues are being updated, we'd ask you to call them and tell them, particularly if you think somebody's been to a particular shop or are a regular shopper at a certain place. It's really all of our duty to make sure, and I know I've been doing that, family members have been doing that. I'm asking all family members to do the right thing. If you've got people like your grandparents maybe, who aren't checking the internet but shop at a particular shop or get their coffee at a particular place and it's popped up. It's really up to all of us. It's up to you in that case to reach out and say to them, have you been here? Let's run through it. Keep everyone you can informed, because you're right, not everyone has all the information all the time.
That's us, Deputy Commissioner. In terms of getting the ADF personnel to assist with compliance, have you had any concerns raised with you from the community about that?
Look, no. The ADF have been working with us for some time, as I said. Our relationship with the ADF goes back through the devastating bushfire period, our compliance operations on the border last year, with our hotel quarantine operations, and I think people should feel reassured that the ADF are with us. They're there to support us, they're there to help, and in my experience, they are very welcomed, and the support they provide is invaluable to us. From a policing perspective, it allows us to stretch our workforce and to be much more flexible about where we put resources. So we welcome the ADF being part of it, of this response. And as I said earlier, the ADF are already on the ground delivering support packages to people that or who are having to isolate at this time. So they're a welcome resource.
Nick, for people that are going out every day under the compliance, if we go into a longer lockdown, what are police going to do about your person that goes to the shop on Monday, Tuesday, Wednesday, using it as an excuse to get out?
Look, it's a challenging time, without a doubt, and it's frustrating for many people who are having to stop doing things that they ordinarily do, but now is not the time to be doing those things. We've mentioned heavier fines that are available to us. As I said, we don't want to have to do that. What we want is 100% of the community to be abiding by the public health orders, and that's not 95%, not 98%. We want 100% of the community to do that, and it's critical to allow the health measures to take effect, that people do stay at home. As I said before, we're seeing people who are abiding by the orders, and the vast majority of the community I want to thank for doing that. Just coming into town today, whilst it's sobering for me being a local, it's quite clear that the vast majority of the community are doing the right thing, and we need them to keep doing that.
Just on that, how do you think the community of Dubbo is going in terms of compliance, and if you have any specific examples of people doing the wrong thing and any updated figures?
You know, that there are examples, of course, of people doing the wrong thing, and it is the small minority. Look, I think the vast majority of people in Dubbo are doing the right thing. You know, Dubbo people are good people, and they do get the job done when it has to be done. We saw that a couple of weeks ago, certainly in the central west of New South Wales, where we had 3 local government areas that were in lockdown, and people by and large abided by the orders and came out the other side of it, and I'm sure that'll be the same here. In terms of examples of people, we had a person overnight who was issued an infringement notice in the middle of the night because he just had to get out and about. Look, I understand that, but again, now is not the time. Updated figures, 24 infringements were issued in the last, or overnight, to people who weren't abiding by the public health orders, and 6 people were charged. Now, across the state of New South Wales, 671 infringements notices were issued in the last 24 hours. So the small proportion of those in Dubbo, to me, is indicative of the vast majority of the community doing the right thing, but they've got to keep doing the right thing.
Nick, I could be wrong. Oh, by the way, welcome home.
How are you? Good to see you.
It seems to me that the concentration of offenders seems to be at the weekend. What sort of concentration will you have with police here over the weekend, this weekend in Dubbo?
Look, thank you for the question. The ongoing Operation Stay at Home compliance operation will be ongoing over the next 21 days. Under Superintendent Denny Sullivan here, you've got every available blue shirt that's dedicated to the operation at the moment. Additional resources will come in as required. We're an organisation with over 17,700 people in uniform. We can move resources around where required, and most certainly I have all the confidence in the world that Danny and his team here know where to put resources, and if it's on a weekend or if it's at a particular time, they'll do that and they'll deal with whatever issues that come up. It is important, I guess, again, for me to reiterate that there is an entire emergency management structure which is in place here, and with a cross-section of government agencies who are there providing support to the community. And it's not just a compliance operation, it's a balance of compliance and support. And that's what we need for Dubbo to get through this current challenging time. And again, it's sobering for me to be here at this time, but I know Dubbo will pull together and get through this.
sort of reaction time has New South Wales Police got if the numbers increase as predicted and Dubbo has to be declared a hotspot and shut it down?
Well, again, we've been working with the COVID situation for 18 months now, so we're flexible. We can move resources around where required. We've seen large-scale operations, certainly in the CBD of Sydney, to address certain problems. We won't hesitate to move resources into areas like Dubbo, other parts of far western New South Wales, should that be required. But again, this is a community issue that we need to work together on to get through this. And so we will get together and we will get through this if the community abides by the public health orders.
Mr. Cochran, can I just ask briefly, in terms of the breakdown of who's catching the virus, is it the same as yesterday, no one over 70, and that's still at that, those 67% I think was Aboriginal people?
That's right. We still have a large proportion of the cases are Aboriginal people, and mainly in Dubbo. And the most significant part of that is 70% of our current cases are aged under the age of 35. So we see a lot of young people, particularly kids, out and about regularly. They are sharing the virus between each other, and we know that that's transmitting within households as well. And so everyone, now's the time to stay safe. Don't leave the home if you don't need to. Don't let your kids go out and play with other kids unnecessarily, and please everyone stay at home.
So there's 21 new cases in Dubbo. Do you know what the breakdown of those were in terms of their ages?
I haven't got the breakdown of the new cases in Dubbo, but it's fair to assume the vast majority of those are close contacts of people that have previously been infected with COVID-19. We know that some of those were infectious in the community.
Scott, we've just heard how much of an impact there has been on schools in the region. Nonetheless, some of them have reopened and some children are going back. Do we know what the vaccination rate is among teachers?
We know we've seen a lot of teachers being vaccinated in recent weeks. I haven't got exact numbers on the total number of teachers in the region, but I really would encourage teachers, police, ambulance, all of our priority workers in the next couple of weeks to come out and get vaccinated as a priority.
Can I just jump in there and quickly address that as well? Just on the school situation, we have currently, there's about 11 students that are going to school, and there's about 18 to 20 teachers that are supervising in a very COVID safe way. So that really 98% of our students are not going to school, and 80-something% of our teachers also are not going to school. Many of them are in isolation, and obviously our thoughts are with them through what's a really difficult time. I've been encouraging, and we've had obviously notices from some teachers and the Federation itself around teachers being recognised. They certainly are recognised as being vital to our community. There are appointments available right now. Many teachers can't get a jab right now because they are isolating, and you can't do that. But pharmacies, obviously the walk-in clinic later, but there are bookings available for Pfizer and AstraZeneca, and I'd be encouraging all teachers that are in isolation now, talk to your local pharmacy where you get your flu shot, book in for as soon as you're out of isolation for that. Book in for the Pfizer at the clinics that are available as well. We want to support you absolutely as much as we can. You can't get a jab for a couple of weeks if you're in isolation, but in the meantime, you certainly can book an appointment, and I'd really love to see that escalated, and then if we need to, we can look at prioritising when everyone's back on deck as well.
You said you're still working out whether it would actually be worth classifying Dubbo as a hotspot. You mentioned that that would then trigger quite a few other restrictions. Can you detail some of those and why some businesses have seen them as not ideal?
Look, the restrictions with a hotspot become far more, lockdown-like, where people cannot move and do business. Now, we have tradies in Dubbo that are working and doing the right thing. We have carpet installers, blind installers, tradies doing renovations in kitchens that are doing the right thing when people aren't at home. They're doing it in a COVID-safe manner, and they're keeping the economy ticking along. If we go into a hotspot scenario, everything stops. That creates lots of issues for businesses. And the reason to think about a hotspot in the first place is around supporting those people who may need some help during isolation. The reality is around that it will pick up a small minority of people and maybe help. We probably just need to find a better way of scooping them up and supporting them rather than impacting the entire business community. I've spoken to the business chamber this morning, I've spoken to several business owners, I've spoken to the Deputy Premier. We will continue to work through that today and have a bit more clarity by this afternoon on, is now the right time for that, or are we better off letting the economy tick along and keep money flowing.
Do you have plans for how to scoop up those people who are impacted that you just identified?
Look, some of that is being worked on. It is very difficult. Sometimes people do fall through a crack, and that's what's being looked at now. Is what is that crack? What does that crack look like? How do we fix that? So that's definitely being looked at as well.
Just quickly, sorry. There were reports of 2 cases in Gilgandra. Can you speak to that at all or confirm?
We're still undertaking contact tracing for any new additional cases overnight. We'll have further details of those once that contact tracing and follow up with venues of concern and anything else is completed.
Scott, just quickly, how come we're now moving out to your Forbes and your Condobolin and Lake Cargelligos for testing for sewage, but we didn't do it earlier?
So we know that sewage detection is just one of our tools in our armoury to try and track down where COVID might be or is. We've expanded to Forbes and Condobolin, knowing there's been positive sewage detections at parks, and so we've wanted to cast the net a bit further. It's something we're looking to do in a lot of different locations across the region, and so we'll continue to expand that when we can.
Just a question for Colonel Young, if I could. I guess what sort of message would you like to put out to the people of Dubbo? I mean, some people perhaps might be a bit intimidated by seeing the uniforms around. What would you like to say?
Look, the message is really simple. We're here to help, and the defence of a nation is not by what most people would think traditionally. It is also about making the citizens of that nation feel safe, and because we've been asked to come here to assist the New South Wales government in their whole of government approach, this is an opportunity for us to provide security to the citizens of New South Wales and make them feel safe.
Final couple of questions, guys. We've got to wrap things up if we can. Anyone?
Yeah, look, sorry, just quickly, Linda Burney was saying that some scars remain in Indigenous communities over military intervention, particularly in the Northern Territory. She said that we need to be careful about how we go about this. How is the ADF planning on doing it in a culturally safe way?
We've already engaged with the Indigenous leaders in this region. I did that personally yesterday with the New South Wales Police and with New South Wales health leaders. With every single engagement that we do, we are going to ensure that there is Indigenous liaison and that it is done in the most courteous and respectful fashion possible.